Hi, my name is Dr. Tess Blignaut, and on behalf of myself and Dr. Melize at Villiers, we just wanted to help the South African public with a bit of a comprehensive outlook on the novel coronavirus, particularly with the outbreak and pandemic hitting our country. We just want to give a bit of information on the virus, how to prevent it, how to manage it if you do get it, what to do in terms of seeing a doctor, and also try and see how we can help each other together as a community to get through this outbreak. So, the novel coronavirus, or COVID-19, originated in Wuhan, China. On the 31st of December, the World Health Organization reported a cluster of pneumonia cases in the province. Epidemiologically, it was linked to a seafood, poultry and live wildlife market in the province. And then there was noted to be person-to-person transmission, with an increasing number in these cases. Then on the 30th of January, the World Health Organization declared a public health emergency of international concern. Basically, in terms of the coronavirus, we know many other coronaviruses, most of them just causing a self-limiting common cold. The outbreaks that are known was the SARS outbreak in 2003, which was linked to bats, and then the MERS, which was the Middle East Respiratory Syndrome outbreak. That was in 2012. That was linked to camels, or bats to camels. But though that's a bit of background in terms of the virus. So this novel coronavirus is quite resilient in terms of it can last a very long time on different surfaces. So that helps us in terms of understanding how we can get it ourselves and where we need to be cautious. In terms of its lifespan, on plastic and stainless steel it can last 2 to 3 days. On cardboard it can last 24 hours, and on copper it can last 4 hours. This is important, obviously, with thinking about how many people can touch these surfaces, and then we touch it afterwards, and then we can transmit it to ourselves. So in terms of this virus, the incubation period, or the period between getting the virus and actually having symptoms, is on an average of 5 days, but it can be between 5 to 12 days. The scary part is that while you are asymptomatic, so you're not having symptoms, and you have the virus, you can still transmit this virus to other people, to those that you love around you. In terms of the duration of symptom, that is very patient dependent as to how severe you have the disease. But generally the time to develop respiratory distress is about 8 days. The novel coronavirus that we're dealing with right now is highly contagious. In terms of transmission of the virus, there are a few routes that we can be infected with it. The first one would be close contact or direct contact with an infected individual. After that, we have quite a significant one in terms of droplet spread. So if someone that is infected coughs or sneezes around you, that's how you can pick up the virus. In terms of a cough, the droplet spread is about 2 meters. That's why in general we should be having social distancing and stay at least 2 meters away from each other. In terms of sneezing, that droplet spread can spread at least 6 meters, which is quite scary, but thank goodness most people that have the virus don't actually present with sneezing. The third route of transmission is actually through touching a contaminated surface. So another patient who's infected has touched the surface. We know that the virus lasts a very long time. Then if we touch it and then we touch ourselves, particularly our face in terms of our mouth, nose and eyes, that's how we can become contaminated. So even something simple as touching the surface and then eating with your hands afterwards, you can become contaminated. In terms of the severity of illness in patients, thank goodness 80% of the people that get the virus will actually have mild symptoms and will be okay. The problem comes in is where 15 to 18% of the people that get the virus will have severe illness, and thereafter 3 to 5% will unfortunately pass away. The risk factors of having severe illness are obviously our elderly population, so above the age of 65, any person with a chronic heart condition, so heart disease, blood pressure, any valve abnormalities. Diabetes is also a big risk factor, chronic lung disease such as asthma or emphysema, clotting conditions, so anyone that is on blood thinners, kidney disease, and of course the immunocompromised. So that will be our HIV population, cancer patients, and any genetically immunocompromised. patient. We are quite lucky that children are less severely affected, but this doesn't mean that it's definitely going to be that in every child, so we've always got to be cautious and monitor them carefully. In terms of symptoms of the coronavirus outbreak at the moment, there was a study done in Wuhan on 99 infected patients. Of those patients, 83% presented with fever, 82% with a dry cough. So basically those are our two main symptoms. It has been reported that a lot of people do present with a sore throat, although only 5% of these patients presented with a sore throat. The other symptoms that you can present with is shortness of breath, obviously because it is a respiratory disease, muscle ache, confusion, headache, rhinorrhea or running nose, which is not a very common symptom with this virus, and then diarrhea. It is important to note that not every patient or every person that presents with these symptoms has coronavirus disease. Other causes could be the common cold. It could be another viral infection or viral pneumonia such as influenza, which is particularly going to start becoming common in South Africa because, you know, influenza season is starting or about to start. Which is why it's important to actually get your influenza vaccine, because that will protect you at least against influenza, because if you get both viruses at the same time, you're at a lot higher risk than if you didn't. The other thing that can present similarly is a bacterial pneumonia. So we have to be aware that there are other conditions that can present the same. The important thing to note with the disease at the moment, particularly because it is still mostly cases from traveling, is if you have had contact with a contaminated person or probable case, if you have traveled to a high-risk area, or if you have worked in or visited a high-risk health facility. Obviously with the symptoms it's very important to monitor for respiratory distress, because that is the most concerning part of this coronavirus, and if they do develop, then to head to a hospital. When monitoring for respiratory distress, there's a few things that we look at. The first thing would be respiratory rate, which is your amount of breaths that you take per minute. So you can time that. Obviously with different ages, there's different higher levels of respiratory rates. For a newborn, which is 0 to 1 month, that would be above 55 to 60 breaths per minute. For an infant, which is 1 to 12 months, that would be above 45 to 50 breaths per minute. A toddler, which is 1 to 3 years, that would be above 40 breaths per minute. And then anything above that, you know, preschool, school-age kids, adolescents and adults, then you would be worried if it's above 30 breaths per minute. Other things that we look out for is shortness of breath or difficulty breathing. So you subjectively are struggling with breathing. If you are using accessory muscles, which would be, you know, pulling in the neck, particularly in kids, it would be using your abdominal muscles and intercostal muscles, and you get subcostal recessions, which is recessions under the rib cage, so indrawing there. And then a last thing to monitor for would be hypoxia, which is bluish discoloration of the lips. In terms of prevention, the most important thing is social distancing. So I know in general we say if we are out, we should be at least 2 meters away from other people, but we should try and limit going out at all. In terms of the spread of the virus, the more you are out, the more you are at risk of being contaminated, and then you're at risk of spreading it to your loved ones, to the community in general. And that is where the risk comes in. The more people we have infected, the quicker the virus spreads. And that is something that we as a country will not be able to deal with. So in general, everyone should avoid, you know, crowded places, sleepovers, play dates. We should rather be staying at home and in a way isolating ourselves, spending time with family and loved ones so that we ourselves can be protected. And even though we might have mild disease, that we can protect those that won't. Those that will have more severe disease, those are not as privileged as us to be able to stay at home and be comfortable in a nice, comfortable home environment. We have a lot of people that need our help to support them and prevent them from getting the virus, where it will affect them a lot more than us. So even things like visiting a local restaurant or a grocery store is putting yourself at risk because you're having more contact with surfaces and people that could have the virus to give it to us. The second thing in terms of prevention is hand washing. Hand washing is not the normal quick soap, put your hand in the water and go. This hand washing needs to last at least 20 to 30 seconds. So in terms of thinking about it, they say sing the happy birthday song, so happy birthday to you. This is a bit of a process which I'm going to go through in terms of hand washing, but it is quite important to remember and know and do. Firstly, we put soap in our hands. Make sure that the soap does lather so that you get some bubbles, so soap and water. If you do not have soap, you can use hand sanitizer, but it is not as effective as soap. So at least with the hand sanitizer shortage, we know we can be covered with soap and water. So first, lather your hands, get the soap going. Every surface of your hand can pick up the virus, particularly the crevices, which is where we need to worry about. So when we start, we've lathered our hands, then we start with the inside of our hands, do some rubbing like that. Then we do back of the hands, both sides. Don't forget about the thumb, that's also there. So keep rubbing your thumb, this side too. Then take your hands together, rub them together like this. Your fingertips are little crevices where the virus can hide and contaminate you. So don't forget about them. Put them in your palm of your hand, rub it around like that, do the other side. Then don't forget about your wrist. Just do the edge of your wrist, rinse your hands, and obviously it is best to dry your hands off with a paper towel, but that's not always possible. So if you do dry it with a towel at home, just make sure that you're washing towels regularly, and particularly in the workplace where you have more people using the towels and at risk of putting the virus on there. Okay, so other tools of prevention is avoid touching your face, mouth, nose, eyes. Don't share any personal items with other people, regardless of if they're your loved ones. Sharing glasses, bottles, lip ice, utensils, we can't do that anymore. We have to be very careful because that virus can be transmitted. Like I said, even when we are asymptomatic. Wipe down high-risk surfaces, so surfaces that are touched a lot, doorknobs, keyboards, stair rails, escalators, elevators, trolleys, credit card keypads. These need to be wiped down regularly to prevent the virus from contaminating the surface. So that needs to be done with a sanitizer, alcohol solutions, household cleaners, or diluted bleach solutions. Then also, once again, wash your hands and use hand sanitizer regularly. Regular sips of warm water has been shown to keep the mouth moisturized, and also, increased intake of warm fluids has been shown to be a preventative measure. So have another cup of coffee, no problem now. And then obviously stay at home. If you're at home, you're not at risk. As soon as you go out, you're at risk. Not only you, the whole country. The reason why we are implementing all of these techniques, I'm sure you have all seen the graph and have heard the hashtag flatten the curve. This is what we need to do. If we do not implement these measures, and if we do not stick to them and become religious with them, we are going to completely overwhelm our healthcare system, which is something that will be devastating in this country, because as we know, we already have a struggling healthcare system. Now we want to add more pressure on it, where we could be using these simple measures to try and help the doctors, our community, each other. So by doing that, then we slow down the spread and contamination of the virus, that it is going at a rate that is manageable for our healthcare system, so that at least we're not having patients that we cannot cope with, and then having to prioritize who we should save over others, which is something quite horrific to have to do. So I urge everyone to please just take this into account. Be careful. Don't think about yourself. It's not a time to be selfish. Think about others. This is trying to protect our country. When someone is symptomatic for the coronavirus disease, basically in terms of screening, we look at a few criteria. So if someone presents with a sudden onset of cough or fever or sore throat or shortness of breath with the added component of them being in close contact with a confirmed or probable case, if they have travelled to a high-risk area, if they have worked in or visited a high-risk health clinic, or if they have severe pneumonia of an unknown cause. That is reason for investigation for the coronavirus. Remember that fever should be above 38 degrees, so not just a mild fever, something severe. When this happens, we need you to call your GP or local doctor. Don't go into the route, because you are putting not only the doctor at risk and then they cannot work anymore, but you're putting everyone else at the practice at risk too. Lots of patients, sick patients that can't afford to contract this virus. Obviously, if you have severe respiratory symptoms, so if you have severe respiratory distress, you are short of breath, then you need to call an ambulance or the emergency department and firstly inform them that you suspect that you might have coronavirus disease, and so that they can take protective measures for themselves, and then either, if it's the ambulance, wait for them to come to you or get to the hospital as soon as possible. So once you have called your local GP or doctor, they will organise and consult with the NICD, where we will organise a local test for you. And the relevant forms need to be filled out, obviously, because it is quite a procedure in terms of monitoring and case confirmation. And then we will wait for the test results. So you will go to the test site, they will do the test, which is either a sputum, which is coughing up phlegm, a nasopharyngeal swab, so in your nose, throat swab. They can do serum and urine. There are quite a few ways to test for the virus. This test result will take 48 to 72 hours. During this time, you must obviously stay at home in self-isolation, obviously to protect the community from the virus. If your result comes back positive and you have mild symptoms, it's not necessary that you will go to a hospital, because at some point, and I think that point is going to be soon, our hospitals will become overwhelmed with patients, and we need to save those hospital beds for severe cases that need oxygen therapy and continuous monitoring. So if you have mild symptoms, then you will be put into self-isolation with symptomatic monitoring to make sure that they do not worsen, and this would be telephonic phone calls to your doctor, and obviously symptomatic management, which we'll go through a bit later. If it's positive and your symptoms are worsening, then it will need to be organised for you to go to your nearest hospital that has isolation services. If it is negative, but you are still a high risk, we need to be aware of false negative results. So then, if you have travelled to a high risk area and your result was negative, it is likely that you will still be asked to stay in self-quarantine and monitor your symptoms and see that they resolve, and make sure that it doesn't worsen and that it isn't a false negative coronavirus result, because if it is, we don't want you to be transmitting that virus in the meantime to others. Also, if that virus test result is positive, we will need to do a whole contact screening procedure, which is quite intensive, but anyone that you have been in contact with within 2 meters needs to be screened for the virus, because they are a potential of having it and passing it on further. And when you are in self-isolation, if you ever do get to that point, there are certain home care precautions that we need to take in order to prevent the spread to your family members. It's important to note that your family members are very high risk of starting with symptoms of the virus too, and having it themselves. So if there is one person in a family that has the virus, then the whole family should isolate to prevent spread to anyone else. So while you are in self-isolation, you need to continue hand washing regularly. You need to clean your environment regularly. You also need to try be in your own dedicated room with your own dedicated linen and utensils. So we've got to be careful with shared environments that we need to clean even more religiously in terms of bathrooms and kitchens, because then you're putting everyone else at more risk of picking it up. So limit the movement around the house of the affected individual. Ensure that the room is well ventilated. So make sure that windows are open, air can flow through, and that can disperse the virus, that it is not as highly contagious as if the windows were closed and there was no airflow. And then we need to monitor while you're in self-isolation for any signs of respiratory distress, because if they do develop, then we need to get you to a hospital. And if you have any queries during this time or any concerns, then you do need to contact your local doctor or GP. with symptomatic management of the virus at home, the biggest thing is going to be fever control. Most of the symptoms you'll be able to get over yourself if you're having mild illness and your immune system is functional enough to fight the virus. So fever control, the most important thing is paracetamol. So your Panado or Panado syrup and Calpol in children, those are really great ways to deal with the fever. There was a study that has come out that is warning us against using anti-inflammatories. So to be safe, I would advise you not to use anti-inflammatories like Brufen, Nurofen, Voltaren, Famovo, Cataflam. Then simple things like throat lozenges. Most of it you can discuss with your local doctor and discuss the symptoms that you are having and how you can manage it further. If you are a person that is traveling back from a high-risk area, I really would urge everyone to please just self-quarantine for at least 14 days. Like I said, the period that you can still be having the virus and not presenting with it is 5 to 12 days. So if you can prevent that spread during those 5 to 12 days, if you do have symptoms to anyone else, you are saving a lot of lives. So please be careful, think about others and keep them safe. So just in terms of a take-home message, let's all be safe. This disease is not about you. It's about all of the other people that are at risk. It's about our country. It's about our community and the people that we love. You may have mild disease, but you don't know who you could spread it on to that has severe disease and has the potential of it being fatal. Limit going out as much as you can, because that limits you catching it and it limits you spreading it on. Let's try be safe. Let's try stay at home, bond with your family. Take this time to regenerate, recuperate, and self-reflect. It's not a time to be selfish, but rather selfless. Think of those less fortunate than you. We do have a community that some can't afford healthcare or access to healthcare, even those that can't afford basic food supplies. Well, you can stock up on all your basic needs. There are a lot of people that can't afford to do that, a lot of people that are going to be losing jobs in this economic crisis, and those are the people that we need to worry about and be there to support. So let's be there for each other, let's help each other get through this tough time, and now is the time for love. Let's be a better community.